Hey, Dr. Ash back with another quick video about cancer points to consider, concerns, and complications. And so this is actually going to be uploaded into the cancer playlist as a part because we are talking about cancer and all things cancer. Yeah, let's move on. All right. So points to consider. Number one, IV chemotherapy destroys tissue. Not only does it destroy cancer tissue, but it also destroys healthy tissue. So it is preferred to be given via a central line because of how heavy and harsh it can be on the vascular system, because again, it destroys all types of cells. However, you can use a peripheral IV or PIV, but the only exception to that is the PIV, you have to assess frequently, like every hour, because the moment that peripheral IV looks like it is going bad, it has got to be stopped and switched, okay? Because chemotherapy drugs are very, very harmful to healthy tissues as well as cancer tissues. When handling chemotherapy, the majority of the time, your IV preparations are going to come from the pharmacy, or you're going to have to go get it from the pharmacy, whichever the facility that you're at prefers. But you always wear your personal protective equipment, always and forever, whether you're handling an IV chemotherapy or whether you're handling a PO pill, crushing it, breaking it, whatever you are doing with a chemotherapy medication, you have to wear personal protective equipment. Radiation therapy, a couple of points here, and I'm actually going to add something really fast to the end of this too, because I just thought about it as I'm looking at this. But radiation itself is very tiring, okay? So it causes fatigue, not only during therapy, but also for months following radiation treatment. It is normal. A lot of times family members and patients get concerned, but it's like I tell people, this is very harsh on your system. Your body is trying desperately to reset and fight off this cancer. And so it is going to be an exhausting process. The other thing that I want to mention is there is external radiation and internal radiation. And for external radiation, we have to be careful of the skin, right? So that's a radiation beam that's directly shooting towards the actual area that has a tumor. And so that direct beam of radiation can actually cause damage to the skin. So you want to make sure that your patients are wearing loose clothing, not exposing that area to the sun, just being very gentle and very careful when handling that radiation area. The other thing that I want to mention here too is that there is internal radiation. And when a patient has internal radiation, they are a walking radiation plant. Okay. So all of their body fluids are radioactive. You should be in the appropriate protective gear if you're in the room. You should be limited to about 30 minutes or less in the room. Visitors should be limited to 30 minutes or 6 feet. The other thing is no children and no pregnant women. Okay, no children and no pregnant women. This again is for that implanted radiation therapy. Also, of course, well, it should come without saying, but these patients are in a private room. Next, I just want to talk about a couple of complications. Are there more? Yes, there are. There are several more, but these are kind of our big ones that we need to worry about. One of them is SIADH, which is also known as syndrome of inappropriate antidiuretic hormone. And so people sometimes have this condition without cancer. And what it is an increase in the ADH, the antidiuretic hormone, which is antidiuresis, which means we hold on to fluid. This could be a pituitary problem, right? Because this gets excreted or secreted, whichever word you want to use, by the posterior pituitary gland. And so oftentimes tumors from cancer can also mimic SIADH. So basically what happens is these tumors secrete a chemical or enzyme that's very similar to antidiuretic hormone. your body recognizes as ADH and it begins to hold on to water. Well, the problem is there is this fluid retention. This fluid retention then leads to hemodilution, which means our hematocrit and our sodium and all the good things that are floating through our body are going to be low. So those levels get really, really, really low. And so our important part to remember to this is the worse our sodium level gets, the worse our symptoms get. And so it may start with just some fatigue, weakness, muscle cramps, aches, pains, things like that, but then it's going to advance as that sodium level drops. And so when we get to like the 115, 110 range, we're talking coma and maybe even death. So we have to be very careful of the SIADH. Infection, of course, infection is a big thing, right? Chemotherapy and radiation both will drop white blood cells as well as neutrophil counts. Of course, this puts a patient at risk for infection. The problem with this is infection can turn to sepsis very quickly. When cancer patients turn septic, they also have a potential to go into DIC, which is basically where the blood clots and clots and clots to the point where it runs out of clotting, and then you begin to hemorrhage. So it's kind of a clotting and hemorrhage state. So you really want to do a good level of prevention for our cancer patients. And so prevention is key. Washing hands, no large crowds, avoiding people who are sick, wearing masks out in public, no handling of animal feces, particularly cat litter, no fresh flowers, wash fresh fruits and vegetables. All foods should be well cooked. And the cancer patient should monitor their temperature, especially when they're not feeling well, and immediately report signs if they are feeling sick, because we have to be very proactive in treating if it is an actual infection in our cancer patients. Next we have, and last thing we're going to talk about, is superior vena cava syndrome. And so SVC, or superior vena cava syndrome, SVCS, occurs when we have a tumor and the tumor growth gets so large that it actually puts pressure on the superior vena cava. So we're talking about an upper thoracic cancer. What happens is this limits the body's ability to return blood back to the heart from the head, the neck, and the upper trunk. Okay, this will also cause decreased cardiac output. So what do you think we're going to see? If we have this fluid trapped in our head and our neck and our upper trunk, we're going to see swelling of the face, upper arms, maybe the hands. They're going to have some difficulty breathing. They're going to have very dilated or large veins of the, it says of the check. I must have been looking for some money, but upper chest and neck. So upper chest and neck. So we have to be very cognizant and pick up on that very quickly when we go in to do our assessments, because we need to immediately assess vital signs. We need to see what that blood pressure is. We need to see what that pulse is. And we need to contact the provider with all of that information ASAP. Because what's going to happen is, again, we circle back to the top where we have that decreased cardiac output. And we talk about this in the perfusion videos. If we don't have cardiac output, we don't get perfusion. So this is a very quickly declining hypoperfusion state. All right, so that's just an overview of some points to consider and some complications of cancer. And I will see you in the next video.